क्या मेरी आवाज आ रही है? So dear friends, anyone has joined offline class on the beauty and pain management in the Bangalore or the Mumbai or anywhere else? किसी ने ज्वाइन नहीं की ना? All are new and fresh ना? Then wonderful. Then excellent.
No, I have joined, sir.
Yeah, Geeta ji, I have seen you. I've seen you. Great.
Thank you. Good morning, sir.
Vietnam, right? You are in the
Yes, sir.
Vietnam. Okay.
Yes, sir.
So Vietnam people are very healthy, right?
Yes, they are healthy. They eat healthy.
They eat healthy, na? Yeah. Because the obesity, the abdominal obesity are very less there, right?
Yes,
And
because
the
mainly
metabolism.
the carbs is less here, sir. They eat more. But of course, the younger generation in Vietnam also are too obese because of junk.
Oh, okay.
Because you have McDonald's, all this KFC, all those
Oh,
Western impact,
here
which
only.
is there, which is bad in China, Vietnam, everywhere.
Okay. That's why. So every entire world is having that problem.
Same problem is there.
Yeah.
Anyway, nice talking to you and seeing you, sir.
Yeah. Can we start now?
Yes, sir. Thank you.
Okay, wonderful. So can I mute everyone? आप सभी को म्यूट कर दूं मैं, तो बीच में कोई डिस्टरबेंस नहीं होगा, राइट?
यस सर.
मैत्री गाला जी, आर यू एबल टू हियर? आपके खूब इंस्टाग्राम के वीडियो आते हैं, मैत्री जी.
Yes, sir.
इंस्टाग्राम क्वीन.
Yeah.
हाँ, एक्सीलेंट, बहुत बढ़िया. करते रहिए ना, और डालिए, बहुत अच्छा. The in Instagram we can see the real form.
Yeah.
Amit ji, can you hear properly? Amit ji?
Sir.
Okay, wonderful. You are from Delhi, na?
Lucknow.
Okay, fine. Karishta ji from Surat. Okay, fine.
Yeah,
Neelam ji? Yeah, Karishta ji. Yeah. Neelam ji, are from which city? Neelam ji? From which city, Neelam ji? कोई बात नहीं, आपकी आवाज नहीं आ रही, कोई प्रॉब्लम नहीं यार, आवाज नहीं आ रही, बट यू कैन हियर मी ना? यू कैन हियर मी?
Sir, from Delhi.
Oh,
New
from
Delhi.
Delhi. Excellent. Tulsi ji, where are you right now? In which city?
अभी तो दिल्ली में है सर.
आप भी दिल्ली में?
आप जहाँ घूमते हैं मैम, अगर वो ऑनलाइन है तो मैं आ जाती हूँ.
That is true. दिल्ली में है. ओके, ग्रेट. बामिनी जी कहाँ पर है अभी?
सर मैं मॉरिशस में हूँ.
आप मॉरिशस में हैं? वाओ.
जी सर.
मैत्री जी, आप कहाँ पर हैं?
Mumbai.
ओह ग्रेट. मुंबई. एक्सीलेंट. रेणु जी, आप तो सूरत में हैं, राइट? सूरत में है ना?
नो सर, कानपुर.
ओह, कानपुर. दैट्स
सर
ग्रेट.
5 साल से कानपुर में हूँ सर.
अच्छा, ग्रेट. तो अभी हमारे ब्यूटी एंड पेन मैनेजमेंट में हम घोस्ट पॉइंट भी डिस्कस करेंगे. घोस्ट पॉइंट, राइट? फॉर एवरी वन ऑफ यू. फिर आप भूत प्रेत भी भगा सकते हो, है ना? मोर पंख मंगवा लेना, फिर कोई भी पेशेंट आएगा तो हु करके आप भूत प्रेत भगा सकते हो. अपना खुद का भूत भी भगा सकते हो, सामने वाले का भी भूत भगा सकते हो, राइट?
200 पेज
Actually, we are going to learn the ghost point in this class. Why? कि आपको लगेगा, लेकिन घोस्ट पॉइंट को समझने के लिए रात को 9 या 10 बजे के बाद क्लास करनी पड़ेगी.
क्लास बैठता मैं मिडिल वाले अनरोल्ड.
इसमें क्या करेंगे, लाइक वी विल बी डिस्कसिंग घोस्ट पॉइंट. यू नो व्हाई? क्योंकि हम सबके अंदर एक घोस्ट भी होता है कि नहीं होता? वी ऑल आर हैविंग घोस्ट इनसाइड. समटाइम वी आर बिहेविंग इन अ वेरी बैड वे. We are doing lots of argument. We are doing something wrong for others, right? That time we are ghost. Okay. So, when we are treating the ghost point, so it's a very clearly written. ये बिल्कुल साफ लिखा हुआ है. The severely suppressed emotions अगर होते हैं, then we treat the ghost point. So number one, I would like to tell you कि what is the meaning of health? Health का मतलब क्या है? So what is the meaning of real health? The meaning of real health is when the energy is flowing in each and every part very properly without any hindrance. उदाहरण के लिए हम बात करें एक पानी की टंकी, the water tank on the roof. So if the water tank on the roof, अगर हमारे छत पर पानी की टंकी है, the pipeline are open, there is no any blockage in the pipeline. So water is coming in the kitchen, water is going in the washroom, water is going everywhere. So this is called the proper water flow, proper energy flow. In the same way, we see the lungs. Lungs is the water tank of the human body. Lungs को हम कहते हैं हमारे शरीर का water tank है. It's sending water to the kidney, it's sending water to the skin, it's sending water to the urinary bladder, it's sending water everywhere in the body. Suppose there is a blockage, then will not able to send. Then what will happen? अगर ब्लॉकेज होगा और इसने पानी को नहीं बेच पाया तो क्या होगा? एक तो ऊपर पानी भर जाएगा, so there will be breathlessness. Why? Because too much energy, too much water is creating suffocation in the upper part. On the other side, their water will not be in the skin, so skin will be dry. Water will not reach to the kidney, so kidney will be dry. So there are two things will happen. दो चीजें होंगी, ज्यादा मत करना चाहिए. कि पहली बात तो इसे कहते अब व्यक्ति को ब्रेथलेसनेस होगी. Lungs are responsible for bringing brightness in your skin. Lungs are responsible for bringing shininess in the hair. आपके बाल बहुत घने हैं लेकिन निर्जीव हैं. You're having very good hair, dense hair, this much hair, but nirjeev, no, well, the dull, it means the lungs energy is very poor. So lungs are responsible to bring the shininess in the hair. Definitely kidney is responsible for more hair, number of hair. How many hair we have generally? We have 1 to 1.5 lakhs hair. आज रात को गिनना, जब फ्री हो जाएंगे ना तब गिनना है बैठ के, एक एक बाल है ना. और अगर 1.5 lakhs to 1 lakhs hair are there in our scalp, right? तो number of hair depends on the kidney. कि आपके बहुत बाल हैं यानी किडनी, essence is good. कम बाल है मतलब kidney sense is weak. When we are doing any work, like suppose we are standing throughout the day, we are using our kidney sense. When we are doing any effort, we are using our kidney sense. Kidney sense is a fuel. We can use it, we can consume it. तो बहुत घने बाल चाहिए तो किडनी essence को बढ़ाइए. If you want to bring the shininess, तो lungs को improve करिए, right? So 3 things we should remember about the hair. Number 1, kidney. Number 2, lungs. Number 3, spleen. Kidney bring more numbers of the hair. Lung bring shininess in the hair. And spleen weak, then it will create dandruff. अगर spleen कमजोर होगी तो dandruff होगा. तो dandruff यानी कचरा, dirt, dirtiness. Dirtiness on the scalp is because of the spleen deficiency, spleen weakness. So whenever we are thinking about the hair, we have to remember 3 things: kidney, lung, spleen. All 3 should be healthy, right? Now suppose the energy flow is obstructed. अगर ऊर्जा का प्रवाह रुक जाए हमारे चेहरे पर, हमारे बालों में, तो हमारा चेहरा डल हो जाएगा, निर्जीव हो जाएगा, स्किन शुष्क लगेगी. मतलब वी आर हैविंग आईज, वी आर हैविंग नोज, we are having good hemoglobin. Still, if someone will looking us telling, oh, this face is not having attraction, this face is not looking like very dull. फेस में कोई अट्रैक्शन नहीं है, डल लग रहा है. आपने कहा यार मेरा हीमोग्लोबिन तो बहुत अच्छा है, everything is good, then why my face is looking dull? Because energy is not flowing properly. So how to make the energy flow properly to the entire this area? So we will see that quickly. We will do some process. As soon as we complete the process, we will pump the energy on the entire face area. हम कुछ मिनट का एक प्रोसेस करेंगे और जैसे ही हमारा प्रोसेस कंप्लीट होगा हम बहुत सारी ऊर्जा को पंप कर देंगे फेस पर, हेयर पर. राइट. सो स्टेप नंबर 1, we have to pump lots of energy to the head area. Step number 2, we have to remove severely suppressed chi. जैसे कि मैंने आपको उदाहरण दिया कि पानी की टंकी से पानी नीचे आना चाहता है लेकिन पाइपलाइन ब्लॉक है. There is a block in the pipeline. If we talk about the human body, there is a blockage in the meridian. I will give you one example of the blockage of the meridian. जैसे आपका किसी से झगड़ा हो गया, जैसे हस्बैंड का वाइफ से, वाइफ का हस्बैंड से, सास का बहू से, बहू का सास से, यानी दो मित्रों का, दो anyone is fighting with someone. After that you're feeling, oh, I'm feeling heaviness here, I'm feeling heaviness. Then you go for the CT scan and MRI, but you will not find anything. Will find anything? No. आप किसी झगड़ जाएं और फिर MRI करेंगे तो कुछ निकलेगा क्या हार्ट में? नहीं निकलेगा. You will not find anything because there is a blockage in the meridian. So if there is a no blockage, then why we are feeling heaviness in the chest? एक लेडी को एक फोन आया कि एक्सीडेंट में आपके हस्बैंड एक्सपायर कर गए. अब जब भी फोन की घंटी बजती है वो घबरा जाती है. 2 साल हो गए. Whenever there is a ring, phone is ringing, she get scared all the time. Why? आप किसी भी रिपोर्ट में ये चीज नहीं आती है. But in the acupuncture, it's very clearly mentioned the emotions also creating the blockages. So these emotional blockages we can remove with the ghost point. हम ghost point से severely suppressed emotions को release कर सकते हैं. So step number 1, we have to flush the energy to the head area. उसके 10 points हैं. There are 10 points for that. With the help of 10 points, we can flush lots of energy to the head area. And step number 2, we'll use the ghost point for releasing the severely suppressed emotions. उसके और भी बेनिफिट है, वो हम बात करेंगे जब हम उस पॉइंट पर आएंगे. Now step number 3, we will be working on the things which is creating more and more melanin in the hair. So now before proceeding, I would like to tell you some theoretical part here. चलिए थोड़ा सा हम theoretical part का quickly discussion करते हैं. तो जैसे आपने किसी के डंडे से पिटाई लगाई, जैसे पुलिस वाले ने चोर को पकड़ा और उसकी खूब डंडे से पिटाई लगाई, या आपने किसी को डंडे से मारा, उसको लगेगी ना. इफ यू आर हिटिंग समवन विद द स्टिक, थोड़ा दर्द होगा कि नहीं होगा? विश्वास जी, दर्द होगा कि नहीं होगा ना? अब आप क्या है कि आप अपनी छत पर खड़े हैं और छत पर खड़े होकर नीचे किसी को माँ की गाली दे दी, तेरी माँ की, तेरी बहन की माँ की गाली दे दी. अब आपने टच तो नहीं किया, लेकिन अब लगेगी इसको क्या? सर डंडे से किसी को मारा तो वो आपको एक बार छोड़ भी दे, लेकिन आपने किसी को गाली बक दी, वो नहीं छोड़ेगा. छोड़ देगा क्या? वो आपके घर में घुस के आएगा, आपसे लड़ेगा। Am I right or not? सही बोल रहा हूं ना? आप रास्ते से जा रहे हैं और किसी की गाड़ी आपकी गाड़ी, बाइक से जा रहे हैं, किसी की बाइक आपकी बाइक से टकरा गई, हो सकता है हम निकल जाए, इट्स ओके, और थोड़ा आंख दिखा के निकल जाए, चलेगा। लेकिन उसने छूटते ही आपको गाली बक दी, माँ बहन की गाली बक दी, ऐसी बक दी जो आपके यहाँ चुभ गई, फिर लड़ाई बढ़ेगी कि नहीं बढ़ेगी? तो पहली जो डंडे की मार होती है, यू आर हिटिंग समवन एंड समवन इज फीलिंग पेन, दैट इज फील फेल्ट बाय, Hindi don't know, okay, I'm speaking English. Suppose you are going somewhere and suddenly you are driving the bike and some other person also driving the bike, and suddenly you are getting a little, very little accident, means just you are touching with that person. Maybe you will do little argument, or you might not do the argument also, and you will go. On the other time, on the other side, suppose you are going from the market and just you're touching with some person and the person is abusing you, telling you very bad sentence about your mother, your sister, means in the like form of abusement, matter will be different. Am I right or not? So there are two types of the pain we feel. Pain number one, we feel by thalamus. Thalamus pain means hitting, pinching, hitting thalamus because of the external stimulus. Second pain felt by the hypothalamus, emotions. When someone is telling you some wrong word about your mother, about your father, about your sister, about your something which is hurting your emotions, that is always more dangerous, because now it's touching your hypothalamus, right? For example, आप जानते होंगे लैला मजनू को, सब जानते हैं, जानते कि नहीं जानते? लैला मजनू, Majnu has suffered with great problem only because of hypothalamus. Why? Because he loved Leila. Now his hypothalamus is stimulated by the love. Now he even ready to die for that love, because the hypothalamus is getting stimulation with the emotions, love, hatred, fear, anger. Even without the touch, person will be having too much changes in the body, right? So nowadays, why we are suffering with the many problems? आजकल हम इतनी प्रॉब्लम के शिकार क्यों हैं? The main reason is hypothalamus, because we are emotionally suppressed. Our emotions are suppressed. We are suppressing our anger. We are suppressing our love. We are suppressing our hatred, or some or the other, because we are living in the family. Suppose the family atmosphere is not favorable, but we have to live in that family, right? Some husband and wife living together, maybe the relationship is not favorable, but they don't have any option. They are fighting, they are quarreling, but still living with each other. So they are suppressing their emotions. So hypothalamus is disturbed. So now it's clear what is the function of thalamus, what is the function of hypothalamus. It's clear. ये समझ में आया ना कि थैलेमस में क्या अंतर है और हाइपोथैलेमस में क्या अंतर है? Now we'll talk about the hypothalamus. Hypothalamus is called supermaster of all the endocrine glands. Supermaster. Supermaster we can consider like Narendra Modi is the supermaster who is controlling entire India, right? Then we are coming to one state. The state minister is the master who is controlling that state. In the same way, hypothalamus is a supermaster and pituitary gland is the master. Okay, so let's try to understand this concept here. यहाँ पर हम इस चीज को समझने की कोशिश करते हैं. So now hypothalamus is the master of master gland, and pituitary gland is master gland. Pituitary gland, master gland, right? Okay. So suppose this is the pituitary gland, and it is having connection with the hypothalamus. Okay, somewhere inside. So pituitary gland is connected with the hypothalamus. So hypothalamus is master of master, and pituitary gland is the master gland. Master gland of all endocrine glands. Would like to show you one image here. एक बार आपको मैं एक इमेज दिखाता हूं. Just to show you that how the hypothalamus and pituitary are connected with each other. ये कैसे आपस में जुड़ी हुई हैं. So now I would like to show you, this is the hypothalamus. आप यहां से देखिए. You can see the hypothalamus, right? This is the hypothalamus, right? और ये जो गोल गोल दिख रही है बटन के समान, ये पिट्यूटरी ग्लैंड है. दिस इज द पिट्यूटरी ग्लैंड. And this is the hypothalamus. They are connected with one stick. ये आपस में जुड़े हैं. So hypothalamus will control the pituitary gland. Hypothalamus हमारे pituitary gland को control करेगा. So now let's look at in this image. This is. तो जो बिंदी लगाई जाती है, the bindi, the third eye points. We are putting the bindi on the third eye point. The purpose to put the bindi here to activate the pituitary gland. This is the activation of pituitary gland. Now, if I tell you about the pituitary gland, अगर हम pituitary gland की बात करें, we can see this is the pituitary gland. You can see now. The pituitary gland can be divided in three parts. इसे हम तीन भागों में बांटते हैं. Anterior part, posterior part, and intermediate part. बीच का part, intermediate part. So we are dividing the pituitary gland in three parts: anterior part, posterior part, and the intermediate part, और बीच का part. तो pituitary gland को हमने तीन भागों में बांट दिया, because every part is having different functions. But I want to tell you one thing: as we take the birth, जैसे ही हमारा जन्म होता है, anterior and intermediate get fused together and become one before the birth. जन्म के पहले दोनों फ्यूज हो जाती हैं और एक हो जाती हैं. So finally we have two part only: anterior part of the pituitary and the posterior part of the pituitary, because middle part is fused with the anterior. So in this way, this pituitary gland can be divided in three parts: anterior part, intermediate part, and the posterior part. But the anterior part and the intermediate part get fused with each other. ये आपस में एक दूसरे से फ्यूज हो जाता है और एक हो जाता है, एक बन जाता है, right? So you can see here, this is the pituitary gland. हम देख सकते हैं, this is the pituitary gland. right? So we can see the pituitary gland is having multiple parts here. This is the posterior part. This is the anterior part, right? तो यहां पर आप देख पा रहे होंगे ये एंटीरियर पार्ट है और ये पोस्टीरियर पार्ट है. And intermediate part is get already with the intermediate part with the anterior part. So now look at here, coming back here. So this pituitary gland, we are dividing in two parts. The anterior part of the pituitary and the posterior part of the pituitary. And with the anterior part, we are having fusion of the intermediate pituitary. Intermediate pituitary. Got it? So in this way, we can divide the pituitary in three parts. Now, in this way, I told you the hypothalamus is the part of the brain who is controlling pituitary gland So how the hypothalamus controlling the pituitary gland? Hypothalamus secreting some hormones. They are called releasing hormone. Or we are telling them RH. Hypothalamus से कुछ हार्मोन निकलते हैं जिन्हें हम रिलीजिंग हार्मोन कहते हैं या RH कहते हैं जो पिट्यूटरी को एक्टिवेट करता है. I will tell you how. For example, I am the hypothalamus. ये था ना. I am the hypothalamus. And suppose this is the pituitary. I am the hypothalamus. I will tell the pituitary, okay, pituitary, work very nice. Work. Who has to work? Pituitary has to work. But I am telling, okay, pituitary, work, I am with you. Work, I am with you. Work, I am. So I am secreting, releasing hormone. They are going to the pituitary gland. Now pituitary release very good hormone because pituitary gland is having support of hypothalamus. For each and everything, pituitary gland is dependent on me. हर चीज के लिए ये मेरे ऊपर डिपेंड है. मैं बोलूंगा बनाओ or secret, then the pituitary gland start secreting. I will tell stop, then it stops secreting. So the main function goes to the hypothalamus. Then after that the pituitary. Is it clear? इतना तो क्लियर हो गया ना सभी को? Is it clear ना? तो पिट्यूटरी ग्लैंड क्या सीक्रेट कर रही है? रिलीजिंग हार्मोन. इसी कारण से आजकल लोग क्यों बीमार हैं? Why the people are suffering nowadays? Because emotion are affecting their hypothalamus, and hypothalamus is disturbed, then it will disturb your pituitary gland. Now there is a turn of the pituitary gland. What pituitary gland will do now? अब pituitary gland क्या करेगी? देखिए. So we already told you the pituitary gland we are dividing in three parts. One anterior pituitary, anterior part of pituitary. Second, posterior part of pituitary. And third, intermediate pituitary, which is fused with the anterior part. Now they will secrete hormones. Intermediate pituitary is get secreting one hormone that is called MSH. एक हार्मोन का सीक्रेशन करती है जिसका नाम है MSH, मींस मेलानोसाइट stimulating hormone. This is secreted by the intermediate pituitary MSH. MSH. So they will work on melanocyte. They will work on melanocyte. So melanocyte stimulating hormone will work on melanocyte. What is melanocyte? Melanocyte is the factory of melanin. Factory of melanin pigment. We know melanin means dark pigment, which is making our skin dark. MSH will work on melanocyte. So MSH will go in your skin. In the skin, we have melanocyte. That's why they are secreting melanin and our skin are black. They are going on the hair. So there also melanocyte cell secreting melanin, so our hair are black. Melanocyte is getting activated by the sun rays. धूप में एक्टिवेट हो जाते हैं. तो हमें पता है कि जैसे हम धूप में जाते हैं तो हमारी स्किन पर पिगमेंटेशन आने लगता है, क्योंकि मेलानोसाइट ज्यादा मात्रा में मेलानिन का निर्माण करता है. तो हमको चाहिए नहीं, स्किन तो काली नहीं होना चाहिए, स्किन शुड बी फेयर. वी वांट दिस, but hair should be black. Am I right or not? Skin should not be black. Skin should not be pigmented. Why the skin is getting pigmentation? Because in the sun rays, our melanocyte is getting activated and they are producing more and more melanin. So we are getting pigmentation here, here, here. Even during the hormone imbalance, we have seen many females during the pregnancy, during the menopause, and because of the hormone imbalance, because of the hormone imbalance, also melanocyte get more activation, so skin become black. Am I right or not? In the hormone imbalance, we see the pigmentation on the face, right? कि जब हार्मोन का इम्बैलेंस होता है, प्रेगनेंसी होती है या हम धूप में जाते हैं, तो ज्यादा मात्रा में मेलानोसाइट का सीक्रेशन होने के कारण स्किन ब्लैक हो जाती है. Skin get black. And in different country we see, in India we know want black hair, but in other country there is a different types of the hair, right? It might be golden hair, brown hair. So there are different type of the melanin, right? In this way, the most important hormone is MSH, secreted by the intermediate pituitary, which can be considered as a part of anterior pituitary. That's why if your hypothalamus is disturbed, then your pituitary gland will get disturbed. And if the pituitary gland is disturbed, then we can see it will affect your melanin formation. Is it clear? Okay. It means if we want black hair, we should have the function of pituitary normal. Am I right or not? Right? Because we have to work from the root source. हमें root से काम करना होगा. We have to work from the root. Okay. So I would like to bring your focus on one disease. एक मैं बीमारी की बात करना चाहूंगा there is a disease, autoimmune disorder. One disease that is autoimmune disorder, or we know white spot or vitiligo. When your own immune cell, आपके शरीर की immune cell, they are destroying anterior or intermediate pituitary. Intermediate pituitary, especially they are destroying the anterior or the intermediate pituitary, so MSH hormone will not get secreted. कि जब आपके शरीर की इम्यून सेल आपके ही एंटीरियर और इंटरमीडिएट पिट्यूटरी को डैमेज कर दें और MSH का सीक्रेशन ना हो पाए. If there is no secretion of the MSH, then no activation of melanocyte cell, no formation of melanin, then skin and entire body will become white. No pigmentation. So this is one type of the autoimmune disorder due to the destruction of intermediate pituitary. This is due to destruction of intermediate pituitary. Is it clear? Right? तो जब आपके पास कोई पेशेंट आता है व्हाइट स्पॉट का, ल्यूकोडर्मा का, तो पहले ऑटोइम्यून डिसऑर्डर को ठीक करो. फर्स्ट फोकस on the autoimmune disorder. How to work on that we'll discuss, because your own immune cells are destroying your own body. आपके खुद का ही immune system आपकी बॉडी को destroy कर रहा है. Okay, and we are having too many autoimmune disorders. You might be knowing many autoimmune disorders like rheumatoid arthritis, like multiple sclerosis, diabetes type 1, that is also autoimmune disorder. Psoriasis is autoimmune disorder. There are many diseases, the list of the disease, Crohn's disease. अभी आप गूगल करके आप डाल दोगे ना कि list of the autoimmune disorder, you will find the big list. In the thyroid also there are Graves' disease, there is autoimmune disorders. Hashimoto disease also autoimmune disorders. Autoimmune disorder means जब आपका शरीर आपके खुद की सेल को नष्ट कर रहा है, आपका इम्यून सिस्टम आपकी खुद की बॉडी को नष्ट कर रहा है. Nowadays the autoimmune disorders are spreading vigorously, right? So now this concept is very clear that we have to work on the anterior pituitary for this purpose. आज शाम को जब हमारी थायराइड की क्लास होगी तब भी आपको ये कुछ चीज हम रिपीट करेंगे वापस, राइट? तो आपको वो भी ज्वाइन करना है, आज का ही ज्वाइन करना है, आपको भी ज्वाइन करना है. ऑनलाइन ही क्लास होगा वो भी सबके लिए. So in that class my focus is thyroid, but I will start from the pituitary gland, right? Pituitary gland. So that time we have to discuss, and that time we'll discuss the treatment of this. इसका treatment हम उस समय discuss करेंगे. So we'll discuss the treatment of anterior pituitary. Now, quickly I will tell you. So when we want to work on the hair, जब भी हम बालों पर काम करना चाहते हैं या स्किन पर वर्क करना चाहते हैं, so number one we have to work on pituitary gland. Number two, we have to remove the blockage. by the ghost point. And number 3, special 10 point to flush the energy, flushy in upper part. And then we'll be discussing hair protocol, hair skin protocol. तो हमें कुछ चीजों पर वर्क करना होगा, right? We'll discuss one by one. तो चलिए, let's come back here. So whenever we are discussing the hair science, this is called trichology. The tricho means hair and ology means the study of the hair, right? So whenever we are discussing anything about the hair, this is called trichology, or we can tell the hair science, right? Whenever we are dealing with the hair, whenever talking about the hair, that is called trichology, right? Okay. And we already have, I told you the number of hair is 1 to 1.5 lakhs. Now hair are made by keratin. Keratin are the dead cells. That's why if we are cutting the hair, we are not feeling any pain. हम बालों को काटते हैं तो दर्द नहीं होता, क्योंकि hair is made by keratin. What is keratin? I will discuss. What is keratin? Remember keratin, so I can discuss a little more about the keratin. Hair is made by keratin, and keratins are the dead cells. Living cell might be in the root, but as they come up, they are dead cells. तो चलिए एक बार मैं आपको केराटिन के बारे में बता दूं. Whenever we talk about the skin, जब हम स्किन की बात करते हैं, स्किन we can divide in 3 parts. हम इसको 3 भागों में बांट सकते हैं. The upper part is called epidermis. The middle part is called dermis. And the lower part is called hypodermis. Right? Hypodermis means the layer of fat or the adipose tissue. सबसे नीचे की जो स्किन की लेयर है वो फैट की लेयर है, एडिपोज टिश्यू की लेयर है. दिस वर्क लाइक ए कशनिंग. ये कशन का काम करती है. कशन का मतलब है आपको ठंड लग रही है, आप रजाई गद्दा ओढ़ के सो गए, तो हमारे पूरे शरीर के ऊपर एक आवरण का निर्माण कर रही है ताकि हमें ठंड ना लगे. इट्स प्रोटेक्टिंग अवर हीट. इट्स प्रोवाइडिंग कशन all around the body. So it's made by adipose tissue, right? And this the dermis. Dermis is made by 2 protein, collagen and the elastin. हमारे डर्मिस में 2 प्रोटीन होते हैं, कोलेजन और इलास्टिन प्रोटीन. अभी आप जाकर सर्च करो, आप अमेज़न में सर्च करिए कोलेजन, आपको इतने सारे प्रोडक्ट मिलेंगे कोलेजन के, इलास्टिन, आपको इतने सारे प्रोडक्ट मिलेंगे इलास्टिन के, कि everyone want to increase the collagen and the elastin, right? I will give you one example. Look at here, collagen supplement. See, just giving one example. ये अमेज़न है, मैंने डाला ये सर्च में कोलेजन सप्लीमेंट फॉर वुमेन. देखो ये आ गया कोलेजन, देख रहे हो, ये सब कोलेजन, मल्टी कोलेजन कॉम्प्लेक्स, कोलेजन बिल्डर, कोलेजन बायोटी. You can see this collagen. Can you see this collagen? And it's written collagen plus hyaluronic acid. ये मैं हाइलुरोनिक एसिड की मैं बात करूंगा, ध्यान रखिएगा। कोलेजन एंड हाइलुरोनिक एसिड, मल्टी कोलेजन कॉम्प्लेक्स, ब्यूटी कोलेजन, collagen, collagen, collagen. What is collagen? Collagen is the protein found in our dermis, and it is making our skin tough. We look young. With the age decreasing, then skin will become wrinkled, soft. जैसे छोटे बच्चे कैसे लगते हैं ऐसे, in the young we are having very tough skin, so we looking youth. So collagen is found in the dermis and responsible for youthfulness. And another protein is elastin. Elastin is providing elasticity to the skin. So our skin is having wonderful elasticity. If we are young, we are youth, skin is having good elastin protein. And with the age, the collagen and elastin protein are reducing. Suppose if we are eating something, suppose we are eating some Ayurveda herbs, we are eating anything, we are eating lots of fruits, lots of dry fruits, lots of green veggies, then we can increase the collagen and elastin. तो हम यंग लगते हैं। और उल्टा करो, दिन भर कॉफी पीते रहो, खूब सारा, यू ईट फास्ट फूड, ड्रिंक लॉट्स ऑफ कॉफी। चलो कॉफी फास्ट फूड फिर भी चलेगा, बट स्ट्रेस इज द doing destruction of the collagen and elastin protein. Stress can bring oldness within 1 week. Stressful people will become wrinkled, and the gray hair might come within 1 week if the person is having very great level of the stress. So in the dermis, we are having mainly collagen and the elastin, and even you can take the collagen and the elastin protein also. In the non-veg also, the collagen and elastin protein is available, but in the veg also collagen and elastin protein is available, and they are making your dermis very tough and wonderful. So we are looking youth. And the third thing is available in our dermis, that is called hyaluronic acid. Hyaluronic acid. Have you seen the sponge? आवाज कम आ रही है। Okay. आपने स्पंज का टुकड़ा देखा होगा। Have you seen the sponge? If you soak the sponge in the water, it will soak the water. In the same way, the hyaluronic acid found in our dermis, and it's made by water. It will soak the water. That's why we are applying some syrup, we are applying the oil. It's going and increasing the level of the hyaluronic acid. Coconut oil is very good oil. We can apply on the skin. Like our hyaluronic acid is made by sponge, it will absorb the water, and our skin will becoming very lubricated and nourished skin. So mainly 3 things found in the dermis: collagen, protein, elastin protein, and the hyaluronic acid. Why I'm telling you, if you want the beautiful skin, then the protein intake should be normal. Olive oil also very good. If you are taking lesser protein, if you are not having enough protein in your diet, it will make you old very fast, because our dermis is made by collagen and the elastin protein, right? They are protein. And hyaluronic acid is who is like a sponge and soaking the water contents, retaining the water contents. So when you are going in the sun rays, then it's creating dryness, because all the water is going out. So that's why we are applying sunscreen cream and all. Now we are coming to the epidermis. Now we are coming to the uppermost layer, that is epidermis. अब हम सबसे ऊपर की लेयर की बात करते हैं, जिसे हम एपिडर्मिस बोलेंगे। हेलो जी, बोल रहा हूँ। बोर तो नहीं हो रहे हैं सब लोग? बोर तो नहीं हो रहे हैं? ज्यादा ज्यादा थ्योरेटिकल पार्ट तो नहीं हो गया? थ्योरी भी थोड़ी समझना जरूरी है ना। तो जब भी हम चाहें, आप अभी आपको फुर्सत मिले ना, जब भी आप फ्री होते हैं, व्हेन यू आर फ्री, जस्ट सर्च इन द गूगल द फ्रूट्स इंक्रीजिंग कोलेजन फाइबर, the fruits increasing elastin fiber, the fruits increasing hyaluronic acid, make the list and eat them properly in the day-to-day life. Then you see within 40 days, you will be becoming very beautiful. Everyone will be asking, what you are eating, what you are doing. They will keep asking you, what you are eating. है ना, कौन सी चक्की का आटा खा रहे हो आप, हमें भी बताओ. Then I will tell you, we are eating collagen, we are doing something to improve our collagen fiber and the elastin fiber and the hyaluronic acid, because this time entire world just want to improve the collagen protein, collagen powder, collagen protein, collagen powder. And many people think that collagen can be improved only by non-veg. No, no, no. Okay, non-veg is having collagen protein, non-veg is having protein, but whether the vegetarian or the non-vegetarian, all the foods having protein, right? Definitely vegetarian food is always good, because it's not only bringing brightness in the skin, but it's also bringing brightness in our soul, right? But anyway, if you are taking non-veg, you can take it. So make the list and include the protein, which improving your collagen and the elastin fiber in your daily diet. Okay. So 3 things we have to remember about the dermis, collagen fiber, elastin fiber, and the hyaluronic acid. Now we are going to the epidermis. अब हम सबसे ऊपर की बात करते हैं, जिसे हम epidermis कहते हैं. Let's talk about the epidermis. Epidermis is the outermost layer, सबसे बाहर की layer, right? The epidermis is having multiple layering. हमारी epidermis में बहुत सारी layers होती हैं. I will show you in the image. Let's see this. So first you see this, ये हमारी skin है. So this is the lowermost part, that is called hypodermis, made by fat. इसीलिए इसे पीले रंग से दिखाया है. This is made by fat. Then this is the middle layer of the dermis. It is made by collagen and the elastin fiber and the hyaluronic acid. We can see the lots of blood vessels, lots of vascular supply is available here. इसमें सबसे ज्यादा blood vessels और vascular supply होती है. And the uppermost layer, we can see here the uppermost layer, that is dermis. It is made by many layers. We can see here. Like see, this epidermis is made by many layers. These all are the layer of epidermis. Right, so I will show you other image now. अब मैं आपको दूसरी image दिखाऊंगा. Let's see this. So we can see here, no need to remember the name, just I'm telling you, like the stratum corneum, stratum granulosum, stratum spinosum, stratum basal. These all are the name of the layer of epidermis. यानी हमारी epidermis होती है कई प्रकार की लेयर से मिलकर बनती है. Mainly you have to remember only 3 things. The skin is made by 3 layers: epidermis, dermis, and hypodermis, right? Now epidermis is made by multiple layer. वो right now my focus is the different. अभी मेरा focus कुछ अलग ही है. And my focus is this. This is my focus. What is my focus? In the epidermis, we are having 4 type of cell. 1, 2, 3, and 4. Okay, the 5th number also, but the 4 are the main cell. हमारी epidermis में 4 प्रकार की सेल पाई जाती है. The cell number 1, melanocyte. Melanocyte. We have already discussed about this. They produce melanin. हम पहले ही समझ चुके हैं कि मेलानोसाइट का काम क्या है. मेलानिन को प्रोड्यूस करना. They found in the epidermis. The more the UV rays, more the sun rays, then skin become dark. So they are the melanocyte cell. They produce melanin. They found in the epidermis. The second cell, they are called Langerhans. They are the fighter cell. Fighter cell. Langerhans. If any bacteria or virus attacking on the skin, they fight. They are the part of the immune system. तो हमारी स्किन में दूसरी सेल पाई जाती हैं जो इन्फेक्शन से, बैक्टीरिया से, वायरस से लड़ती हैं. They are called Langerhans cells. The third cell, Merkel cell, means we feel touch, we feel stimulation. Someone is pinching our skin, we are feeling touch sensation due to Merkel cell. तो मर्केल सेल के कारण हम फील करते हैं कि कोई पिंच कर रहा है, कोई दबा रहा है, कोई एक्यूप्रेशर कर रहा है. Someone is doing acupressure, someone is doing pinching and all. And fourth and the last cells, they are called keratinocyte cells. These are the outermost cells and protect our skin. ये हमारी स्किन की वो outermost cell बनाते हैं. Keratinocyte cell. Keratinocyte. The outermost skin, or we can tell dead cells, right? The main important here is keratinocyte cell, because hair is made by keratinocyte cells. If the keratinocyte cells are producing the keratin, ये keratin का निर्माण करती हैं और इसी से हमारी स्किन की आउटर मोस्ट लेयर बनती है. इसी से हमारी हेयर बनते हैं. So mainly we have to understand in the epidermis we are having 4 cells. Number 1, melanocyte, produce melanin, dark pigment. Number 2, Merkel cell. So we feel touch, we feel temperature, we feel pinching sensation, we feel acupressure sensation because of these Merkel cells found in the epidermis. Number 3, Langerhans cells. They are the fighter cell. ये हमारी fighter cell है. Fighter cells, right? So they fight with the bacteria if attacking on the skin. They fight with the virus if attacking on the skin. Any pathogen who is attacking on the skin. So they are the part of immune system. ये हमारी immune system का part है. And the fourth and the final cell, that is called keratinocyte cell. They produce dead keratin. The outermost layer of the skin. And the hair is also made by keratin. बाल भी केराटिन से बनते हैं. So that's why we are cutting the hair, we are not feeling the pain, because these are the dead cells. And even if you see the outermost skin is also painless. अगर आप एकदम outermost skin की बात करें, आप skin को खींच कर थोड़ा सा कुछ pinch करें, दर्द इतना नहीं होगा, right? क्योंकि the outermost cells is made by keratin cells. And remember one thing, एक नदी के पास आप खड़े, you are standing on the side of the river and you take 1 glass of water. It is a flowing river, continuously flowing. Take the 1 glass water. Now after some time, take again 1 glass water. Is it the same water? No. Now that previous water already gone long far away. Am I right or not? Because there is एक नदी बह रही है, एक गिलास पानी निकाला, थोड़ी देर के बाद दूसरा गिलास निकाला, तो पहले वाला पानी तो बह के आगे निकल गया ना. In the same way, our skin is changing every day. Every day skin is shedding off. When we are doing the cleaning of the home, there are lots of skin particles here and there, but we can't see because they are very small. Very, very small. Every day, the outermost layer, the keratin cells are shedding off. Every day. And there's a new formation of the keratin cell, shedding of the keratin cell, new formation of the keratin cell, shedding of the old keratin cell happening every day. But these changes are very slow, so we can't see. But suppose these changes are very fast. Suppose the lots of formation of the keratin cells. Then we can see, have you seen the patient suffering with the psoriasis or dandruff? Dandruff, we do like this. And the white scaling is coming out. Have you seen that? कि dandruff हुआ किसी को तो सफेद सफेद इकट्ठा हो गया, या psoriasis हुई सफेद सफेद इकट्ठा हो गया, और ऐसे करेगा तो झड़ेगा वो क्या है? वो the formation of the keratin is a little higher than the normal. But it is with everyone. It is with you, it is with me, it is everyone every day. Already the formation of the keratin cells every day. But when this process becomes fast, then we are telling psoriasis or dandruff. Now we are just rubbing the skin and the white scaly particles are coming out, right? Now suppose I want to tell you one thing. I will ask one question from you. Tell me. एक यहाँ पर image देखिए. Look at here. So this is the middle layer, or called dermis. Sorry. So we know this is the middle layer, or dermis. This is the outer layer, or the epidermis. Yeah. And this is the sweat gland. We can see this is sweat is coming from here. This is the sweat is coming here, right? We know the oil is coming up, sweat is coming up. Lots of things are coming. बहुत सारी चीजें ऊपर आती हैं. We can see this is the sebaceous gland or the oil gland. So look at here. This is the hair. ये बाल है. This is the hair. So hair is going down, and this is the oil gland, or called sebaceous gland.